Hi everyone, welcome to Osteo Momentum. I am Dr. Sumaya Shahul PT, physiotherapist, educator, and specialization in musculoskeletal.
In this video, I will be discussing about the most important clinical tool for differential diagnosis of low back pain. The test is called SLRT, that is straight leg rising test, also called as Lesago test. There are so many confusing and questions related to low back pain. Is the SLRT is done in active or passive, or the pain is related to neurological or any joint dysfunction or any weakness in the muscle or tightness in the muscle. In this video, I will be explaining all these confusions very clearly and in a practical manner. Let's get started.
So, basically, the SLR or straight leg rising test is performed passively. While doing that SLR, if there is any SI joint dysfunction is present, then it done in active manner to confirming SI joint dysfunction. While doing SLR, the patient complains of pain in between 0 to 30 degree, it's related to hip pathology. 30 to 50 degree, it's related to sciatic nerve. 50 to 70 degree, hamstring tightness. And 70 to 80 degree, it's SI joint dysfunction. Next to identification of SI joint dysfunction, the test is performed by using an active SLR in combination with pelvic compression. Instruct the patient to actively performing the SLR while the patient is raising the leg. Apply a pelvic compression on the same side of the raising leg. Same side therapist giving the pelvic compression. If the patient is easy to do this or the patient complains of decreasing the pain, it's a suspected of anterior torsion, and if pain is increasing, suspected of the posterior torsion of the SI joint while doing this active SLR with compression. Another test to identification of force closure at SI joint, instruct the patient to actively flex and rotating the trunk towards the side of that SLR is actively performed. The trunk rotation is resisted by the examiner. This is helpful for to identification of weakness of abdominal and multifidus muscle. Next, for to identification of neurological involvement in low back pain. First, tibial nerve. Along with the SLR, to do ankle dorsiflexion, foot eversion and toe extension. Ankle dorsiflexion, foot eversion and toe extension. If the patient complains of any neurological symptoms like tingling sensation or numbness, this test is positive. That is, tibial nerve is involved. Next, for the identification of sciatic nerve involvement, easy remember by DIS. That means dorsiflexion inversion, that is sciatic nerve. Dorsiflexion, foot inversion, that is for sciatic nerve. Next is a common peroneal nerve. Along with the SLR, here plantar flexion and foot inversion. Plantar flexion and foot inversion. This also, patient complains of any neurological symptoms, this test is positive. Thanks for watching and please subscribe our Osteo Momentum family. Just learn smart, not hard.